Understanding and the care of Alzheimer patients. Alzheimer's disease is a form of dementia that spreads within the brain, causing a disorder, which channels memory loss. The brain controls the intellectual functions, which starts to decline the mental capabilities over time. Alzheimer's disease is the most common form of the primary disorder known as dementia. Rather, the condition Alzheimer's disease spreads out to develop dementia, since it is silent and becomes aggressive as a person ages. Alzheimer's has affected approximately 4.6 million men and women in the United States, and the number has expected to rise to 16 million people by the year 2050. Alzheimer's disease is very rare amongst people younger than 60 years of age, yet it is spreading widely across the nations. Alzheimer's normally affects the older generation, yet the disease may start earlier than most people realize. Yet, Alzheimer's affects up to 50% of people older than 85 years old. We must remember that this disease is not a normal part of aging, yet aging symptoms has something to do with the condition. Doctors and scientists are making steady progress in understanding of the way Alzheimer's affects the brain, yet they have not reached conclusions due to the lack of understanding the structures within the entire channels of the human makeup. The cause of the condition is still unknown, yet experts think that family history and genetics are related factors that play a role. Studies have shown that parents or siblings diagnosed with Alzheimer's disease have the chance of developing Alzheimer's than people with no family history of the illness. Alzheimer's disease is a progressive illness, which means the disease and its symptoms worsen over time. Once diagnosed, a person can live up to 10 years or longer after he or she is diagnosed of the disorder, yet it depends on the extent of care provided and preventive measures taken as to how fast the disease advances. This period depends on the person, yet the symptoms develop over the same general stages. When Alzheimer's is present, some people may behave in an unfamiliar fashion, such as the person might forget how to drive a vehicle, or how to act in the public. The patient may even forget how to get dressed. In the severe stages of dementia, people with Alzheimer's may forget family members or even close friends. All types of behaviors are lost because the area in the brain that controls them no longer is working. As a caregiver, you must understand the disease and its symptoms. Alzheimer's has been called the family disease, because it touches the lives of everyone around the patients. The care that is required for a loved one of Alzheimer's, it can be very demanding. Alzheimer's can demand new levels of time and attention and energy, but many family members find that providing daily care within the home can help reduce stress. Sometimes for many years finding out that you have Alzheimer's disease can be very frightening, yet treatment is available. To date, there is no cure for this illness. A prescription may slow the progression soon. However, early diagnosis is a very important factor in treating the disease. This disease can take as much as 10 to 20 years for any signs of symptoms appear, which makes it one of the most frightening conditions in the medical directories. In some regions of brain, the brain tissues, cell etc., causes memory loss. The cause of Alzheimer's is not entirely known but is thought to include both genetics and environmental factors, which is why people should seek medical checkups often.